Neuromodulation and tinnitus. A look at device evolution and treatment progress. Patients considering neuromodulation treatment for tinnitus typically have numerous questions about what to expect. The following section addresses the most common inquiries based on current clinical evidence and practical experience. Understanding these aspects can help individuals make informed decisions about whether this treatment approach aligns with their specific needs and circumstances. Remember that while these answers reflect general information, individual experiences may vary. It's always recommended to discuss specific concerns with a qualified healthcare provider who can offer personalized guidance based on your particular tinnitus presentation and medical history. What makes neuromodulation different from traditional tinnitus treatments? Is neuromodulation painful or uncomfortable? How soon after starting treatment might I notice changes in my tinnitus? Will my tinnitus return if I stop using the device? Can I use neuromodulation if I have a hearing aid or cochlear implant? These questions reflect common concerns among patients considering this treatment option. The answers provided below are based on current scientific understanding and clinical experience with FDA-approved devices. As research continues to advance, our knowledge about optimal use patterns and expected outcomes will continue to evolve. How long does it take to see results from neuromodulation treatment for tinnitus? Response timelines vary significantly between individuals, but most patients who benefit from neuromodulation begin noticing changes within 2 to 6 weeks of consistent daily use. Some report subtle improvements in tinnitus intensity or distress within the first few weeks, while others experience more gradual changes that become apparent toward the end of the standard 12-week protocol. It's important to note that neuroplastic changes typically develop progressively rather than suddenly, so patience and consistent adherence to the treatment regimen are essential for optimal outcomes. Are neuromodulation devices for tinnitus covered by insurance? Insurance coverage for neuromodulation devices remains variable following FDA clearance in 2023. Some private insurance plans have begun covering these treatments, particularly for patients with severe treatment-resistant tinnitus who meet specific criteria. Coverage decisions typically consider factors such as documented failure of conventional treatments, significant impact on quality of life, and adherence to approved protocols under appropriate medical supervision. For patients without insurance coverage, manufacturers often offer payment plans or financing options to make treatment more accessible. Some practices also provide rental options or trial periods that allow patients to evaluate effectiveness before committing to purchase. It's advisable to contact both your insurance provider and the device manufacturer directly to understand specific coverage options and potential out-of-pocket costs in your situation. Can neuromodulation completely eliminate tinnitus symptoms? Complete elimination of tinnitus occurs in a minority of patients, approximately 15 to 20%, according to clinical trial data. More commonly, successful treatment results in significant reduction of tinnitus intensity and distress rather than complete silence. Many patients report their tinnitus becomes less intrusive, easier to ignore, and less emotionally disturbing following treatment, even if the perception remains detectable under quiet conditions. The clinical goal of neuromodulation is typically considered improvement in quality of life and reduction in tinnitus-related distress rather than complete symptom elimination. Most patients who respond positively to treatment experience meaningful improvements in sleep, concentration, emotional well-being, and daily functioning, even if some level of tinnitus perception persists. These functional improvements often represent more important outcomes than changes in the acoustic properties of the tinnitus itself. Are there any side effects from using neuromodulation devices? Neuromodulation devices for tinnitus have demonstrated excellent safety profiles in clinical trials, with side effects typically being mild and temporary. For bimodal devices like linear, the most commonly reported side effects include temporary tingling or metallic taste sensations during tongue stimulation, minor discomfort at the stimulation site, and occasional headaches, especially during initial use. These effects are generally well tolerated and often diminish as patients become accustomed to the treatment. Importantly, clinical trials have not identified any serious adverse effects associated with FDA-approved devices when used as directed. There is no evidence that properly administered neuromodulation worsens tinnitus or causes permanent changes in sensation or function. As with any medical device, patients should promptly report any unexpected or concerning symptoms to their healthcare provider for appropriate evaluation and management. Can I use neuromodulation alongside other tinnitus treatments? Neuromodulation can generally be safely combined with most conventional tinnitus management approaches, potentially offering synergistic benefits. Many patients successfully use neuromodulation alongside hearing aids, sound therapy, cognitive behavioral therapy, or tinnitus retraining therapy. The multifaceted nature of tinnitus often benefits from this comprehensive approach, addressing both the neurological aspects through neuromodulation and the psychological or functional components through complementary interventions. When considering combination therapy, it's important to coordinate care between all involved healthcare providers to ensure treatments complement rather than conflict with each other. Some specific interventions may need scheduling adjustments to avoid interference. For example, separating neuromodulation sessions from certain sound therapy protocols. Your tinnitus management team can help develop an integrated treatment plan that maximizes benefits while minimizing potential conflicts between approaches. For patients with complex tinnitus presentations or multiple contributing factors, this multimodal approach often yields the best outcomes. By addressing the condition from multiple angles simultaneously, combination therapy can tackle various aspects of tinnitus generation and perception, potentially offering more comprehensive relief than any single intervention alone. Neuromodulation for tinnitus continues to lead the way in developing innovative solutions that can work alongside traditional tinnitus management approaches.